All right, so we are recording now. So hi, welcome everyone. Welcome to the Palo Alto University PhD's programs, health psychology area of emphasis. And just for some quick introductions, my name is Robin. I'm a senior admissions counselor. And so most of you, or some of you, have probably connected with me at some point during your admissions journey or this application cycle. And I will also have my email in the chat right now, just in case, after this, you do have questions about the program. And then also we are with Dr. Matthew Cordova, which he'll make his introduction shortly. So Dr. Cordova will be doing their presentation. And if you do have any questions during the presentation, feel free to raise your hand in the reactions tab, or you could also enter them in the chat as well. So I'll let Dr. Cordova take it away.
All right. Can folks hear me okay? Robin, can you give me a thumbs up?
Yes.
Yeah. Okay, great. All right. So good to meet y'all. My name is Matt Cordova. I'm a professor at PAU and have been at PAU for about 20 years, teaching health psychology. I also have an interest in trauma, and so have a couple of different hats I wear at PAU, and am excited to talk to you about our health psychology area of emphasis. Robin was asking about questions. If people have questions as we go, please just unmute yourself or raise your hand, or just put them in the chat. I'll kind of keep track. And if you have a question that I'm not answering, feel free to just unmute yourself and grab me. And my idea is to talk maybe 15, 20 minutes and then answer questions that you have. So, but we can ask and talk as we go. So, health psychology area of emphasis. You might wonder, why do we have such an emphasis? Well, and you may or may not know a whole bunch about health psychology, but health psychologists basically do a number of things, and I'm really specifically talking about clinical health psychologists today. These are psychologists that are trained well and generally as clinical psychologists first and foremost, so able to help people who are dealing with different psychological and psychiatric issues, and then also have training in helping people with adjustment to illness, changing health behavior, screening people for different kinds of health care, like getting a kidney transplant or a bariatric surgery, or receiving gender-affirming medical care for trans folks. So there are a number of things that health psychologists are involved in and work a lot on healthcare teams could work in primary care, or could work in settings like specialty medical settings, like in a cancer clinic or a pain clinic or things like that. And so we need people who can do this for a number of reasons. One is that we know that physical and mental health, well-being, so physical functioning and mental health functioning, are really hand in hand. We know that our stress response system impacts our physical health, that people's physical well-being, how they feel in their body, has a direct impact on their mental health and indirect impact. So for instance, people who have limitations due to pain or illness can't do a lot of the things that they're interested in doing that make them feel good about themselves, and that can impact their mental health that way. And just to put it as an example, somebody who's depressed and leans maybe on substance use, smoking or drinking, or isn't as physically active and engaged, is going to start to have physical health problems over the long run. So there are a number of ways that we know that physical and mental health are closely intertwined. I mentioned some of the roles that clinical health psychologists play. So I mentioned assessment, so evaluations for different medical procedures. For instance, somebody who has back pain may want a spinal cord stimulator implanted that might help disrupt that pain or the pain messages. But not everybody is appropriate for that. Or somebody who has weight gain and obesity that's impacting their health and their longevity may consider bariatric surgery. But if they have a binge eating problem, for instance, or uncontrolled or not poorly well managed, not well managed PTSD, that might get in the way of them managing stress or being able to stay on track with a diet they're going to have to follow. So health psychologists do evaluations to determine whether or not somebody is ready for that kind of a thing. Like I said, we do all kinds of intervention focused on pain, improving people's sleep, improving people's health behavior, weight loss, helping people with different kinds of impairments like visual impairment or acquired disability, onset of illness and decline. So health psychologists are quite involved in those ways. And then I mentioned that we work on teams. So very often clinical health psychologists who are working, for instance, in a primary care clinic might be working with a primary care provider who's a physician or a nurse practitioner, but also working with nurses and dietitians and physical therapists and occupational therapists and chaplains and people from other medical specialties like endocrinology. And so we have special training that gives us an ability to work well with other professions and appreciate what they do, and maybe from the biopsychosocial approach add some things to their awareness. But then also we may be helpful in facilitating team interactions, unsticking problematic team interactions. So that's another role that we can play. And then, of course, clinical health psychologists work in industry and evaluate programs either in an academic medical center or the care that they're providing, like evaluating a group that they run to see if it could be improved, but also do kinds of evaluations to detect health disparities, to evaluate the quality of life impacts of medical care. So an example would be a health psychologist who works with a pharmaceutical company evaluating the quality of life impact of chemotherapy drugs. So there might be two chemotherapeutic agents that could help people live longer, but they may have very different profiles of side effects. One that makes people more depressed and disrupts their sleep, or gives them more physical side effects that weigh on them emotionally. So that would be good to know about. And that's the kind of work in research and industry program evaluation that health psychologists are involved in. And then, like I do at PAU, conduct research, teach, consult, and play different roles. I would say the biggest reason that health psychologists are needed is that not everybody, and in fact, very few people proportionally, go seek mental health care when that is what they're needing. More often, people go to their medical doctor or a healer or a faith leader in their community. And so having health psychologists integrated into specialty medical settings and primary care and other areas enables people who, for internalized stigma reasons or access and financial resource issues or kind of cultural beliefs about where and what kind of care you can get or should get, this is an opportunity for us to level the playing field and make sure people have access to care that is well integrated. And a lot of people going to see their medical doctor would be interested in mental health care or behavioral approaches to their medical problem, but just don't have the bandwidth. They don't have the time or the energy to make it. So I came right before this meeting from working in a pain clinic all morning where I work at the VA when I'm not at PAU. So we saw veterans who are dealing with issues regarding physical pain, but they have a lot of comorbid mental health issues, and being able to be a one-stop shop for them really changes the way that they can get care that they need as whole people. So that's the why. Why do we have this role? And our objective in this health psychology area of emphasis is it to do a number of things. First, we want to help bring people to PAU who have this interest and help train and mentor them into the field of health psychology. I also believe that people who are going to go be generalists should have health psychology information under their belt, because just like I was arguing, if somebody's in primary care, you need to know all the mental health stuff that you could bring to bear on their problem. If you were, let's say, in a general private practice and somebody's in your office who has poorly controlled diabetes and starts to look impaired in the moment, it could save their life to know, oh, low blood sugar or uncontrolled high blood sugar could lead to a medical crisis. And so having the health psychology training is one thing that can help you be more effective as a generalist. So we want to, as I was mentioning, help you all and people interested in this field understand and have skills to reduce health disparities that we know are rampant in across all the fields of health and mental health. We want to give people foundational skills and knowledge to do the work of health psychology, but then also because we know that burnout for any helping profession, but particularly in the medical profession, is so high. We want people to have long, healthy careers where their own personal wellness and the wellness of their patients and the people they supervise, other healthcare professionals who they work with are going to be attended to. So we have a class at PAU called Professional Wellness, and it's essentially a class that is teaching students skills along these lines, ways to track and understand their own reactions and needs, those of their patients, those of people they supervise, and their peers and people from other disciplines, so they could be agents of change in systems that are not always very forgiving and supportive. Let me pause for a minute. I'm going to stop sharing just for a sec and see any questions people have so far. If you don't have a question, no problem. Hi, yeah, Meredith, it looks like you have your hand up.
Hi.
Hi.
Yes, thank you. Thanks for taking us through that. I am sort of aware of health psychology, but it also gets conflated or confused sometimes with behavioral medicine. And I wonder, like, if you could just kind of talk about how this is different.
Yeah.
And then a second question would be more specifically, like you're talking about in certain settings where you're maybe like assessing a patient to do certain things, but do you often then refer to another psychologist to do like a CBT intervention?
Yeah,
or are
great
you able to do that as a health psychologist as well?
Yeah, great question. So behavioral medicine, so our terms can sometimes be used synonymously. So when I think of clinical health psychology, I think of behavioral medicine. That's how I define myself as a behavioral medicine specialist. But there's the Society of Behavioral Medicine, which is an interdisciplinary international group, and that involves people from all disciplines. So there's social workers, there's psychiatrists, physicians, and psychologists. So behavioral medicine might be a superordinate term if we were using it technically, but like I work at the VA in the behavioral medicine service. So we are clinical health psychologists. So for practical purposes, when you're talking about, oh, the person does clinical health psych or BMed, behavioral medicine, I call them the same thing.
Okay.
Yeah. So the other thing you asked is what about, would you, if you do an assessment or an evaluation or see somebody like in an integrated care setting? So because behavioral medicine people work in all kinds of settings, so behavioral medicine or clinical health psychologists work in primary care. I work specifically at a behavioral medicine clinic at the VA. So we receive people that we do one-off evaluations for or repeated ongoing therapy for. Also in primary care, you can see somebody once or every time they come back, or different models have different stipulations of how long you can follow folks, but you could see somebody in many models up to, 5, 10, 15 times, which may be enough to help them with the problem that they have. So you could be kind of a consult liaison type person who sees somebody and refers, or sees somebody and treats in the setting you're in. It really depends on the setting. And to put more teeth on that and give an example, somebody who has mild depression in a primary care clinic and comes to see their the doctor may say, hey, I'd like you to see Dr. Mogensen, and she's going to see you and do this evaluation and see how to help. And you may decide, oh, how about, do you want to come back and see me in a month and use some of the strategies we talked about today? And you may see that person, 2, 3, 4, 5 times. But if you saw somebody who you thought, this person has more severe problems, they're going to need more consistent and probably longer term follow-up than I'm outfitted to do, I might move to refer them to a more long-term setting or a more specialized type of treatment if I'm not the one to provide that, like formal substance abuse treatment, or to a PTSD clinic, or et cetera, et cetera.
Okay,
But
yeah, that makes a lot of sense.
yeah, and in our setting, we have people like me, clinical health psychologists, in primary care who can see people and then refer to us in my behavioral medicine clinic for prolonged courses of care, as an example. So the same people with the same training, one person might be doing that on short-term basis and referring to people who have in another clinical setting where they could see them in a long-term way. So like for sleep, you may do 3 sessions of sleep and then refer somebody to formal cognitive behavioral therapy for insomnia, for instance. So yeah, and to be clear, I'm kind of blending in this discussion, like giving you some examples of clinical things that happen in the non-PAU job I have, but it's representative of what happens in the field in general. So Kaiser has lots of roles like this. The VA, so Kaiser Practica have these kinds of roles. VA Practica have these kinds of roles, and other settings that PAU students do Practica in often have these kinds of roles. And then certainly internships and postdoctoral fellowships that you do later in your training can help people get even more specialized. Just for time, I'm going to jump back to my slides just for a moment, but please, if you have other questions, just holler. So the meeting the requirements, and this may be premature and too much information for you to really want to hold right now, but we'll make these slides available if that's helpful. And you can find them on the health psychology area of emphasis website within PAU. But there are 3 main ways that 3 main things students have to do to meet the requirements for the area of emphasis. And this is pretty typical for the other areas of emphasis. So one is coursework, the other is research, and the other is clinical. So in the health psych area of emphasis, there are 3 health psychology classes. I mentioned provider wellness. This is a class I teach with one of my physician colleagues who teaches at PAU part-time. We teach skills that we kind of think of as foundational skills, like mindfulness meditation, self-compassion, gratitude practices, care of your physical well-being, like eating right, sleeping well, substance use management, those kinds of things. Then we think of intrapersonal skills, which is tracking your level of stress and emotional arousal and physical arousal and managing that through different strategies. And then we think of interpersonal skills, which are about boundary setting, assertiveness, managing conflict, nonviolent communication, reflective listening, things that we probably think, oh yeah, those are pretty common, understandable skills, and talk about how to apply those to ourselves, our patients, and our colleagues. So that's what that class is about. And it's very experiential, lots of doing in class. Health Psych 1 and 2 are kind of bookends. They're survey courses about health psychology. The kinds of things that I've been describing to you so far, we talk about in depth. On Monday, I just taught this class on Monday, we were talking about cardiovascular disease and talked about heart disease and the changing health behavior, the adjustment issues, the adherence issues, and then did some role playing of a vignette around a patient who had a health issue that was in the cardiovascular disease realm, and having people play therapist and patient and kind of work through what would happen in that kind of an encounter. So that's kind of an example of what happens in Health Psych 1 and 2. In addition to these 3 required courses, you have the option of taking some combo of 2 of these bulleted items here. So there's some classes that overlap with another area of emphasis in pediatric behavioral health. that Dr. Friedberg, who's retiring, has been teaching. Someone else will be teaching those by the time you all come on board. LGBTQ health and mental health, substance use, management of crises. You'll see the various things here, health disparities, and then a couple of briefer classes in digital health and technology that would constitute meeting one of the two electives. So we want students to take the 3 required and at least 2 of these electives. The other thing is a research project in specifically your dissertation that is substantively related to the field of health psychology. And this is a somewhat vague term, substantively related, and we've kind of kept it vague because this is a new health psych emphasis, is a new area of emphasis. So we're trying to help students meet this requirement while also doing something that is adjacent or in the field of health psychology solidly. So an example might be somebody looking at the effect of childhood stressors on sleep quality or on physiological arousal and stress related problems in adults, or eating disorders and their link to trauma or pain or some other kind of thing. So, you know, what happens is that when a student is considering this area of emphasis, as they start talking with their dissertation chair, if I'm not that person, and they're in maybe another lab, and they are wondering, okay, how can I meet this? I would meet with that student, possibly together with their dissertation chair, and help, kind of help them scope out what would be a good way to meet this requirement while doing the work they're also interested in, that their dissertation chair may be quite familiar with, but maybe less area interest or experience with health psych. So we kind of pool our resources and try and guide students to meet this requirement. And then I mentioned practica. So the other is we want students to have some kind of practicum exposure in a health psychology realm. And this is also pretty broadly defined. I've listed here some of the practicum sites that Palo Alto University students often land at, but it's also the case that you may not land a practicum at one of these sites and instead meet the requirement for this on internship, which is what happens, in your later years, usually 5th year of the program, where you're on internship at a time in a place doing full-time clinical work. And there are plenty of places in the country where you could match at that have primary care mental health integration rotations, health psychology, behavioral medicine rotations, or specific areas of work. For instance, those areas I mentioned, pediatrics, pain, sleep, oncology, et cetera. So those are the ways that students would meet the requirements. There are lots of ways to get more information about this area. So APA has a Division 38, which is about health psychology. There are also primary care psychology, and we mentioned Society of Behavioral Medicine. These are other areas you could get exposure and kind of wrap your head around it. The webpage where we talk about specifically about the area of emphasis for health psychology, which is very overlapping with what I've presented. And then there are also a number of PAU alumni that are out in the country leading programs in health psychology in some way or form. They're training directors, they're program managers, they're doing this clinically, and they're doing this as far as supervising people in training. So you can see, and this is a short list. There's literally dozens and dozens and dozens of students who have done this over years, but these are a short list of folks that said, yeah, send people my way. I'm happy to talk about my path and ways they've gotten to where they are in their career, and can be good guides in thinking about this. So I know I've rushed. I know we have 5 minutes left. I'm going to stop sharing and want to see if you have questions. And if we don't run out of time for questions, I'm happy to answer questions via email or hop on a phone call or another kind of meeting to answer questions that might be helpful to you. anything I said that was confusing or that I went over too quick, or just that you have interest in, want to comment or ask questions about? Yeah, Lindsay.
Hi, so I had a question related to kind of dual interests or overlapping interests. I'm interested in like children, kind of pediatric, behavioral health, and then also health psychology, working with
Yeah.
kids that kind of had medical involvement or things like that. So I was wondering how those can kind of overlap in the
Yeah.
program and work together.
Yeah, of all the ways of combining areas of emphasis, that's the easiest one, I would say, because Health Psychology 1 is a required class for the peds class. And I would say, I don't know the percentage, but I'm going to guess 50% of the people that are in my health psychology series, provider wellness and health psych 1 and 2, are also doing the peds emphasis. So, I mean, pediatric psychology is really health psychology, as I'm describing it, applied to kids. So it's really the same ideas. And so, yeah, it kind of goes, they're an easy one to combine. Trauma and health can be combinable. What gets tricky is because of the overlapping requirements. I mentioned peds and health psych go together pretty easily, but the others, you have to kind of ration your electives and really like look at them side by side and kind of crosswalk to say, how can I, because sometimes people just run out of elective space. And so you want to be intentional if you were going to do that, kind of as you start looking at your schedule, thinking about, okay, how do I check the boxes in both of those? But people do it. A lot of the people at PAU are doing that.
Thank you.
Yeah, thanks. It's a great question and good reminder. Anybody else?
Any last minute question? Anyone have one more question before we close out?
I'm dropping in the chat my email and phone number. So texting, calling, emailing, whatever works for you. If I can't get back to you, I will eventually. So if you have questions that came from today or down the road, you have questions, even if you don't, even if you are not working with me, even if you are not at PAU, wherever you are, if you have questions about this, I'm happy to be a resource for folks. So just, yeah, keep in touch, reach out. Happy to talk at any point.
All right.
Thank you so much, Dr. Cordova.
Yeah, thank you. Thanks, Robin, for organizing everything.
All right. Thank you. Thank you, Dr.
All right.
Cordova.
Y'all have a great day. Have a good weekend.
All right. Thank you, everyone.